Welcome back to This Week in Politics on KSFY. Iowa Governor Kim Reynolds has a problem in her state. At one time, 9 insurance companies were offering coverage as part of the healthcare marketplace. Then that number fell to none. One company is now back in, but no one knows for how long. And the governor is calling on Congress to get this fixed. When Kim Reynolds was being sworn in as Iowa governor last May, the healthcare situation in Iowa was already at a place of crisis.
We had our last 2 carriers in our individual healthcare market indicate that they were pulling out.
The healthcare marketplace in Iowa was collapsing, leaving at least 17,000 Iowans in the lurch, not knowing how they would get medical coverage or how much it would cost. One provider, Medica, has returned to the Iowa market, but the governor says because they have an unintentional monopoly, their prices are high.
We've seen premiums increase at 57%, and so still have Iowans, especially farm families, working class families, small business owners that can't afford the 57% increase in premiums.
It's not just the price some Iowans are having to pay that concerns Reynolds about all of this. There is an economic development price that the state may have to pay as well. People will not want to move to a state where health insurance options are so limited and so expensive. Last month, during her Condition of the State address, Governor Reynolds told a joint session of the Iowa legislature that this problem is being dumped into their laps by the federal government, but that the federal government is the one that must figure out how to fix this.
Nearly everything that's important to our future, our schools, jobs, energy, growth, depends on the health of our people. If Iowans aren't healthy, they can't learn, they can't work, they can't take care of their families, and they can't succeed.
Reynolds tells me to call this situation frustrating doesn't do it justice.
When we entered into this, we had some of the lowest premiums in the country. We had some of the highest participation rates. We had a very robust market, 9 carriers in the system, and a week before I was sworn in, we were down to none.
The governor says she is working with the state's congressional delegation and the Trump administration to show them that the problem Iowa and the nation is facing can't simply be placed onto a back burner.
It's not sustainable, it's unworkable, and it's collapsing. And so while I still call on Congress to do their job, I can't wait for them to fix it.
This problem with health care comes as the Reynolds administration is increasing its efforts to bring new residents and new businesses to more rural areas of the state, areas where economic development is more theory than practice. The governor tells me sky-high insurance prices will interfere with those efforts. In fact, she says they already are. And when I asked her for an example, she had one for me.
Take a family of 4 farmers, two kids, their income about $67,000. Their premiums were between $30,000 and $33,000, and you just can't do that.
So Governor Reynolds has thrown down a gauntlet to members of the Iowa House and Senate. Craft legislation this year to make more health care options available.
While I continue to call on Congress to repeal and replace the Affordable Care Act, we can't wait for Congress to fix it. This session, we must work together to pass legislation that gives Iowa farmers, small business owners, and their workers access to affordable insurance.
And we thank Governor Kim Reynolds for her time. We will check some political headlines when we come back. You're watching This Week in Politics on KSFY.